Hi, nice to meet you, April.
Mind if I ask you some questions?
Absolutely, if it gets me in surgery faster.
Okay. Can you tell me your name and date of birth?
I'm Barry Stinson, July 21st, 1952.
Okay, and what are you having done today?
I'm having my knees replaced. It's definitely needed done within the last couple of years and sucked it up. I'm going to get it done now.
Okay, you're getting both of them done?
Yes.
Okay.
Yes.
Are you kind of nervous?
A little bit. You know, my wife, she's been dealing with a lot of health issues herself, so I've been kind of putting it off. She's been dealing with COPD for quite a few years, and I'm her primary caretaker, so
Okay.
it's kind of been rough on us, but you know, I know I'll be laid up for a little bit, but if I get it done now, I think I'll be able to, you know, care for her, you know, a lot easier. So.
Okay. Do you have anybody that can help while you're here in the hospital?
We have a neighbor that's going to come over and just check on her. You know, she's
Okay.
pretty good right now. That's why I picked this time frame to have her, you know, to come in to have the surgery. But my neighbor's just going to check in and make sure if I need anything.
Okay.
So.
Okay, well that's good. I'm glad you have a plan in place. Well, I'm sorry to hear that your wife is not in the best of health. But Dr. Neely is a very, very good surgeon, one of our top orthopedic surgeons. So she'll be in to talk with you to have you sign a consent form.
And there's Dr. Neely.
Hi, Barry.
Hi.
I'm Dr. Neely.
Yep.
Nice to see you again.
Yes, thank you, Dr. Neely.
Remember seeing you in the office?
Yes.
Okay, I just want to go over a couple things with you here, if that's okay.
Absolutely.
All right, this is your consent for surgery. All right.
Okay.
Basically, what it says is that we're going to be doing bilateral knee replacements for
Right.
you.
Mhm.
Okay. The surgery will take a couple hours, so you'll be in
Okay.
there for a little while. You'll go to the recovery room afterwards,
Very good.
and then you'll be going to the orthopedic floor
Okay.
so that you can have some recovery.
Perfect.
If you want to take a minute and read over the risks right here, just to
Sure,
go over.
sure.
Their risk to anesthesia, of course, their
Right.
risk to surgery. And I just want you to read over
Sure.
that so that you're aware of those.
Now, Doc, it says something about blood transfusion. I'm a Jehovah's Witness, so I really don't want to get a transfusion.
Okay, we'll make sure that we document that in your record, April, if you could do that,
Okay,
that'd be
thank you.
great. And that way, usually you don't normally lose a lot of blood with the knee replacements,
Okay.
but if it should come to that, would you consider taking blood if it is an emergency?
Only
If it would
it's
save your life?
Only if it's an emergency, Doc. I
Okay.
really don't want to.
And would somebody else, if you're not awake, would somebody else be able to tell us that it would be?
My wife,
Okay.
she's at home right now, so I think I talked to in the office. She deals
Right,
with a lot of health
right.
issues herself,
Yes,
so she's
yes.
not able to be here. But I think I'll give the nurse the
She's
phone
available
number
by phone?
to make sure that she has
Yeah.
that.
Okay,
And
great.
we'll call her to make sure she's aware of that.
Sure, yeah, because
Possibility, that's
Right.
correct, possibility or possible situation.
Okay.
Do you have any questions, or do you
No, I
understand
think you
all of
covered
that?
most of it in the office, Doc. You know, you said the recovery is a couple weeks. You know,
Yes,
so-
recovers a couple weeks. The
Okay.
normal is that you go to a rehab center because you need to get your strength. They'll work with you first here.
Right.
You'll see physical therapy while you're in the hospital, but of course that's for a short period of time. When you need longer rehabilitation, you'll be going to another place, okay?
Okay.
So the case managers will talk to you about
I was
that,
going to say, I
discharge
definitely want to
planning.
speak with the case
Right,
manager. 'Cause
absolutely.
I want to get home, so.
Oh, understand that.
Okay.
But I just want to reinforce to you that the knee replacements are going to help you. That's a good thing. And you just need to kind of like prioritize, okay, what you're going to be doing. And the end result is you still want to be able to take care of your wife. So you have to
Right.
take care of yourself
Right.
first.
Very good.
Okay.
All right. Where do I sign here, Doc?
Okay, just right down here.
Okay.
Yeah, don't lean on those knees.
All right.
Do
Thank
you have any questions for me?
No, I'm ready to go. All right. So thank you
Okay,
very much.
well, the next time you see me will probably be after surgery.
Okay, all right.
And we'll take very good care of you. April's going to continue with all her work, okay?
All right.
Thank you. Thank you,
very much,
April.
Dr. Neely.
Yeah, I just have a few more questions for
Sure,
the admission
sure.
paperwork. Let's see here. Do you have any past medical problems that we should know about?
I do have high blood pressure and I have
Okay.
high cholesterol. I had a paper or something. I don't have it, but you know, I do take low pressure and Zocor. I think Dr. Neely's office, you might be able to check with them because I did preoperative measures or paperwork that showed that.
Okay. I'm
Oh,
sorry.
speak- Oh,
Barry, I
oh,
picked this
thank-
up.
thank
I'm so
you.
sorry. I picked
So
that up
here
on my
is-
way
here
out.
is it does have the medications on
Okay.
it. Very good.
All right, good. I'm glad you brought that in.
Thank you,
because,
Dr. Neely.
that really helps with getting your medications ordered after surgery.
Right.
If we know the right doses and the right medications.
Okay, yeah.
Okay. Okay, great. And let's see here.
I really could use something for paint.
Oh, okay. I could see if we have anything ordered for you.
Okay, sure.
Here in a second. Can you hang on us
Absolutely.
a little bit? Okay,
Yeah,
all right.
yeah.
Now you mentioned you have some religious practices. You're Jehovah's
Right,
Witness,
Jehovah's
so I'm going to
Witness,
put this
yeah.
in here.
Okay.
Would you like us to have the chaplain come see you?
No,
No?
that's okay.
Okay.
No, don't need to see anybody in here for.
Okay, all right. That's fine. We offer that to everyone.
Okay.
Barry, are you a smoker?
I am.
Okay. How many years?
I've been smoking for probably about 35, 40 years.
Okay, and how much?
Probably about a pack to a pack and a half a day.
Okay. So while you're here in the hospital, are you open to having a nicotine patch?
I've tried those before, April, and they just don't seem to be effective. But if you want to try it again, I mean,
Okay.
it's up to the doc.
Then I'm going to make a note to have Dr. Neely order one for you.
Okay.
Just because you're going to be in hospital a few days and you won't have the opportunity to smoke.
Okay.
But, you can always take this opportunity, that you can't smoke to try and quit. And,
Sure.
we can certainly give you some information about that, okay, to help you do that. Okay. All right, I think that about does it for the paperwork, and I'll get you some of the pain medicine here, and we'll get you ready for surgery.
Okay,
All
very
right.
good. And will I be able to call my wife before surgery just to kind of
Yes,
say I'm going
yes,
in?
yes. Actually, could you just tell me what her phone number is?
Sure, it's 267
Okay,
424
okay.
0549.
And what's her name?
Chrissy.
Chrissy, okay. So I'll come back in with some of the pain medicine, and then we'll give her a call then, together. All right? All right.
Okay, Barry, we have one drain out already, so let's get the other one out, okay? There we go.
Oh, geez, Doc, have you ever taken one of those out before? Oh, my God.
Pretty many of them. Did that sting a
That-
little
that
bit?
stung. We're
Oh,
gonna get
I'm
some-
so sorry.
Well,
How is
pain
your
medicine.
pain, by the way?
It's hurting, but if I hit the pain button, it seems to be working. Can I keep that today? Or?
Well, today what we're going to do is we're going to give you pain medicine by mouth.
Okay.
We want to get you eating since you were eating. The pain
starving.
medicine by mouth would be good. We're going to start moving you around, so it's going to be important that you don't have all these added extras. So the pain medicine, we'll make sure it's under control with those oral medicines, okay? And we want to make you sure that you're still breathing and doing your incentive spirometry, taking those deep breaths, because that's very important, okay? April, I'll touch base with April, make sure that we
Good.
have
So
the
the
plan going.
nurse is going to be in soon?
Yes, absolutely.
Okay.
Okay, I'll go touch base with April, alrighty?
All right. Thanks,
Okay,
Doc.
I will be seeing you soon.
Be a little more careful pulling those out, Doc, okay?
Oh, he's ruthless. He's a ruthless patient.
Hi, April.
Hi, Barry. I hear you're giving Dr. Neely a hard time.
Yeah, well, I've been in here all night, kind of in some pain, but that pain button seemed to work, but she says I got to take some oral pain meds now?
Yeah, that's right. With this kind of medication, it's great because it works fast, but it doesn't last long.
Okay.
Now that you're eating solid food and you're doing fine, you're not nauseous or anything?
Yeah, I'm
Okay.
good.
Okay,
I'm
good, good.
you know.
We're going to take that down now. If you take pills, they last longer.
Okay.
And it'll just help you better with the pain because it does last longer.
Right.
This is nice, but since you're eating, we can get rid of the fluids. You won't have a line tied to you anymore, and you'll be able to get around better just because of that, okay?
Alright.
So I'm going to give you your pain meds, all right?
All right.
And take this down,
Take that
shut
down.
all that off, okay? Get rid of the IV.
All right, thank you.
You're very welcome. I also have some of your other morning medications.
Okay.
Okay, I had that nicotine patch for you.
I really
You
need to smoke.
Yeah, I kind of
Okay.
figured. So, so I have that for you to help
Okay.
you out, okay?
All right.
And I have your other morning meds, your blood pressure meds. Your blood pressure was fine.
Okay.
That we can give it to you this morning and
Okay,
stuff. So,
great. All right, so
okay.
you're going to be in with those in a few minutes? the
yeah,
nicotine patch?
yeah, I will.
Okay.
Yes.
Can I speak with or will I be able to talk with the case manager? I just want to check and see how my wife's doing. I haven't been able to call her yet today, so.
Yeah. The case manager will be in a little bit. They usually come in around 9 o'clock.
Okay.
And so they'll be in any minute, and they'll be seeing the new post-ops, which are on their list. And they'll be helping you to set up what your discharge plan is. The plan most likely is that you'll go to rehab.
I have to go to rehab?
Well, it's a good idea with the bilateral knees. You just need a few extra days, and you know, as you can see, it's a little crowded in the hospital, so
Right.
you can get up and move around a little more there, and you have a little more freedom than you do here. And they'll be able to work with you longer as far as therapy and stuff to get you to where when you go home, you'll be able to function at home and be safe. Okay?
All right.
Especially because of the fact that your wife isn't able to help you out as much as maybe you know, other situations.
Right.
So
Someone gonna show me how to get up out of here?
yes, actually, I can show you how to do that this morning.
Oh, good.
Okay.
Okay.
All right.
Very good.
Okay, Barry, I gave you your pain medicine, so now we're going to get you up out of bed.
Sure.
All
sure.
right?
All
Now, I don't want you to get discouraged if it's slow going at first, okay? You had
Okay.
surgery,
Okay.
okay?
All right.
But I'm
I
going
got to take care of my wife, so get me home as soon as you can.
Okay, we'll see what we can do. Okay, let's take your pumps off here. All right, and let me get this out of the way. Oh, you're not gonna be able to- Yeah, I bet. That's all right. Okay, so I got your walker here. What I'm going to do is I'm going to help your legs, all right? And I need you to try and scoot yourself over to the side of the bed, all right? There you go. Okay. All right?
Yep.
Okay. Now you're going to try and come a
Don't-
little bit
don't let
further
go.
to the edge. I'm not.
Okay.
I got you. Okay. I'm gonna yep, rest your feet on the ground. There you go. And take a second.
Got another one of those pain pills?
Well, you just had it a half hour ago,
Okay,
so I'm
all right.
sorry.
All right.
Okay. Now what I want you to do is you keep at least one hand on the bed. You can put one on the walker.
Okay.
Okay? You want to keep your knees out like this. You don't want to get them up underneath you and bend them too far.
Okay. Yeah, I can't bend my knees at all.
When you stand up, I want you to try and use your upper body strength to help pull you up too, okay?
All right.
All ready?
All right.
Ready? 1, 2, 3. There you go. Good. Now you want to stay looking upward, straight ahead. Great. How do you feel? You feel dizzy?
Yeah, all right.
Okay, good.
I could definitely use another pain pill, but I know.
Okay.
I know. I can't
Okay.
have that. So.
Okay, give it a chance. Okay, now just little small steps. You're going to have a hard time lifting your feet. They're going to feel heavy.
Okay.
You feeling dizzy at all?
No, I'm good.
Okay, good. All right. Oh, you're doing really well for bilateral knees.
Okay, so how far do I have to go?
Maybe over to here.
Okay. Now, if you get me out to have a cigarette, I think I could walk out there.
Oh, okay. Well, we're not going to do that.
Okay.
So
All right, no cigarettes today.
no cigarettes today.
Hi, Mr. Stinson. My name
Hi.
is Kirsten. I'm one of the case managers.
Hey, Kristen.
Just going to ask you a couple questions.
Sure, sure.
And all right, first we're going to start off about rehab. You'll
Okay.
be. Is there any certain facility that you have a preference for, or?
Well, April is telling me great things about Good Shepherd. So
Okay.
if you could get me into Good Shepherd, do you know how long of a stay they usually have? people
usually,
there
usually a Good Shepherd's about 3 to 5 days.
for? Okay. All right.
Okay. But yes, Good Shepherd has a great reputation, so I feel that's a good one for you.
Good, good.
And questions about your home.
Okay.
I understand you have a bi-level home. How many stairs are exactly? in
It's
your-
about 5 stairs up, 5 stairs down.
Okay.
I'll be probably down on the downstairs part.
Okay.
Has a TV, since I'll be walking around, but a big screen down there. So
Okay. I know you need the big screen. I know.
absolutely. Yeah.
Is there any other obstacles or anything like that in your home?
We have some carpeting and stuff, but we can there's some throw rugs, so we'll just pick the throw rugs up.
All right. Wonderful. Wonderful. Okay.
Therapist told me to get rid of them. That was coming in talking.
Yeah, that's a good idea. Okay. Do you have a bathroom on the first level?
I don't. That's the unfortunate thing.
Okay.
I know they said something about you guys can set up for like commodes.
Mm-hmm.
Yeah.
Yes, we'll gladly give you a commode. And
Okay.
do you have a walker or any ambulating assistance?
I've been using the walker here. Can I take it?
Yeah, absolutely.
Okay.
Absolutely. And do you have any help at home at all?
We have a neighbor that's been kind of helping out with just my wife if she needed anything. But my kids live down in Florida, so
Mhm.
it's not like they can just come on over if we have a problem. But Is there some visiting nurses that could come out?
If you remember April from earlier, she's a visiting nurse and she will surely come over.
Really?
Yep,
Wow.
yep. She'll come
Okay.
over and check on you and see how you're doing.
Okay, okay, cool.
And make sure that everything is working out for you. And if you have any concerns, you can
Okay.
talk to her and she can talk with us and we can help you out as much as we can.
That's awesome. Okay.
Okay, and any other specific concerns that you have
I
at all?
don't think so. Just trying to think. No, I think we're good.
Okay, well, we'll set you up with the commode, and we'll make sure you can take your walker home, and I'll contact Good Shepherd, and
Okay.
we'll get you going.
Okay.
All right.
Well, thank you very much.
Oh, you're welcome. And anything else at all before I head out?
No, I'm good. Thank
Okay.
you very much.
All right, wonderful, wonderful.
All right, so how's it looking, April? How are the legs looking?
They look great, Barry. Your incisions look nice and they're healing nicely.
Yeah,
The
once the
staples
doctors,
came
yeah.
out and stuff, and everything looks good.
Good.
You're bending them really well. Therapy tells me that you're doing really well, so there's really no reason for me to come back anymore.
Okay, great. Yeah, they've been coming in about, twice a week. And,
Okay.
I've been able to get up with a walker, using it less, but still having to use it especially when the pain kind of increases a little bit.
And you feel
but-
pretty steady when you're getting up and moving around?
Yeah, pretty good. Actually, about pretty much the same as I was, before surgery. So
That's
it's just
great.
a matter of working through, getting that flexibility back and stuff the therapist told me. So.
Sure. And how's your pain?
Pain's been pretty good. I'll take the pain pill, right before doing a little bit of the therapy,
Okay.
like if I, get up for breakfast or something like that, or
Okay.
help out with my wife,
Sure.
definitely we'll have to take a pain pill before then, but about twice a day. maybe.
Okay. And how is your wife doing?
She's doing good. Yeah, so she's upstairs right now, but I pretty much have my bed back there. They brought the bed stuff for me after I spoke with the case manager a couple weeks ago. They brought that in for me, and I got my walker. So
Okay.
Seems to be doing pretty good.
Great, great. And what did the doctor say about going back to work?
The doctor said I gotta probably wait another month. I let him know about me definitely having to get paid because I got clients waiting for with my contracting job
Okay.
I need to get paid so I can start paying some of those bills back. But
Okay.
the doctor says if I just do another month, I'll definitely be back to work. So.
Okay, great. Well, the key thing is to take it slow.
Yeah,
Listen
my
to
wife.
your body.
My wife and I,
Yeah.
and you are on the same page with that because
Yeah.
she wants me to go slower about it. So.
Right. Yeah. You don't want to have any setbacks to where won't be able to go into work at all.
Right.
So you just want to take it easy and stuff.
Right.
And you have a neighbor that's been coming over to help at times.
Yeah, not as much as obviously when I was in surgery, but my kids, they're always calling up and checking on me. I don't know if I mentioned my kids when I was in the hospital, but I have two kids, both living in Florida, and one's actually pregnant, gonna have a kid soon, so I'm gonna be a granddad.
Well,
so
congratulations.
little stressful, different kind of stress I've been through,
Yeah.
but it's it'll be great.
Okay,
Have
well,
a
good.
little-
You'll be up running around with the kid in a year,
That's what I hope. Yeah,
Yeah,
if
so-
I'll be working a lot, but I'm sure I'll have some time to spend with them.
Well, good, good. I'm glad everything's going well. Is there anything you can think of that you need before I go?
No, I'm so happy. I mean, you were my nurse in the hospital. You're a nurse here now. I mean, that's just amazing how
Yeah.
you guys just can do that.
Yeah, they like to pair one nurse up with
Right,
one patient.
that's
It's all
amazing.
part of that
Okay.
continuity of care.
Right.
Yeah.
So, all right. Well,
So-
thank you, April.
Yeah,
I
yeah.
appreciate it.
And how's the smoking cessation going?
Well, I almost forgot to tell you, I quit.
Oh, that's great news.
35 years down,
Yeah.
my wife's now starting to, quit smoking because it was, making her COPD worse. So,
Yeah.
so they got us on the track. We're doing the patches. I have a temptation every now and then. But,
Well, sure. That's
you know.
certainly understandable, but
Yeah.
the thing is even if you do cave in and you have a cigarette, don't quit.
Right.
You want to
Yeah,
keep at
the
it.
smoking cessation program the hospital set up for me was very good.
Oh,
so,
that's
yeah.
great to hear. I'll definitely
Yeah.
let them know it's a good program. So,
Great.
all right, Barry. Well, if there's nothing else,
No,
you have
that's
our
it.
number.
Yeah,
If
thank you very
anything
much.
happens that you need us and
Yeah,
stuff.
I'll
But,
follow up with Dr. Neely's office. So
Okay, great.
sounds great.
Alrighty.
All right, well,
It was
thank
a
you very
pleasure.
much.